Assalamualaikum warahmatullahi wabarakatuh. Hello guys. Firstly, let me introduce myself. My name is WIJAYANTI. I'm currently study at Universitas Negeri Semarang, majoring in public health. Now I want to tell you about maternal mortality during the COVID-19 pandemic. Maternal mortality is defined as deaths occurring in women while pregnant or within 42 days of termination of pregnancy, irrespective of the duration and size of the pregnancy, from any cause related to or aggravated by the pregnancy or its management, but not from accidental or incidental causes. The risk of maternal mortality is highest for adolescent girls under 15 years old, and complications in pregnancy and childbirth are higher among adolescent girls aged 10 until 19. Women in less developed countries have on average many more pregnancies than women in developed countries, and their lifetime risk of death due to pregnancy is higher. A woman's lifetime risk of maternal death is the probability that a 15 years old woman will eventually die from a maternal causes. In high-income countries, this is 1 in 5,400 versus 1 in 45 in low-income countries. What are pregnant women dying from? A woman dies as a result of complications during and following pregnancy and childbirth. Most of these complications develop during pregnancy, and most are preventable or treatable. Other complications may exist before pregnancy but are worse during pregnancy, especially if not managed as part of the woman's care. Major complications that account for nearly 75% of all maternal deaths are: first, pre-existing medical conditions exacerbated by pregnancy such as diabetes, malaria, HIV or AIDS, obesity. Severe bleeding, mostly bleeding after childbirth. And third, high blood pressure during pregnancy, and that are preeclampsia and eclampsia. And fourth, infections. And the fifth, obstructed labor and other direct causes. And the seventh, unsafe abortion or abortion complications. And the last, blood clots. The remainder are caused by or associated with infections such as malaria or related to chronic conditions like cardiac disease or diabetes. In addition, during the COVID-19 pandemic, access to health services was restricted because it was feared that it would expand the spread of COVID-19 cases. How can women's lives be safe? Most maternal deaths are preventable, as the healthcare solutions to prevent or manage complications are well known. All women need access to high-quality care in pregnancy and during and after childbirth. Maternal health and newborn health are closely linked. It's particularly important that all births are attended by skilled health professionals, as timely management and treatment can make the difference between life and death for the mother as well as for the baby. Next, severe bleeding after birth can kill a healthy woman within hours if she is unattended. Injecting oxytocics immediately after childbirth effectively reduces the risk of bleeding. Infections. Infections after childbirth can be eliminated if good hygiene is practiced and if early signs of infections are recognized and treated in a timely manner. Next, preeclampsia should be detected and appropriately managed before the onset of convulsions or eclampsia and other life-threatening complications. Administering drugs such as magnesium sulfate for preeclampsia can lower a woman's risk of developing eclampsia. To avoid maternal deaths it's also vital to prevent unwanted pregnancies. All women, including adolescents, need access to contraception, safe abortion service to the full extent of the law, and quality post-abortion care. Then, some things to do from health services. First, quality care before, during, and after childbirth. Second, essential medicines such as antibiotics and oxytocin. Third, safe blood supplies. And the last, contraceptions and safe abortion services. Why do women not get the care they need. Poor women in remote areas are the least likely to receive adequate health care. This is especially true for regions with low numbers of skilled health workers. The latest available data suggests that in most high-income and upper-middle-income countries, more than 90% of all births benefit from the presence of a trained midwife, doctor, or nurse. However, fewer than half of all births in several low-income and lower-middle-income countries are assisted by such skilled health personnel. The main factors that prevent women from receiving or seeking care during pregnancy and childbirth are: first, poverty; second, distance to facilities; and third, lack of information; fourth, inadequate and poor quality service; and the last, cultural beliefs and practices. So, to improve maternal health, barriers that limit access to quality maternal health services must be identified and addressed at both health system and societal levels. Okay, I think enough from me, dear WIJAYANTI. I'm so sorry if I have so many mistakes. So, wassalamualaikum warahmatullahi wabarakatuh.